You're listening to a brief excerpt from Addressing the Iron Triangle of Healthcare with Clinical AI, Protecting Revenue While Improving Health Outcomes, co-sponsored by Javion. During this webinar, Tom Lowry, National Director of Artificial Intelligence, Health and Life Sciences, Microsoft, and Dr. John Showalter, Chief Product Officer, Javion, explain how clinical artificial intelligence offers the promise of improving the iron triangle equation.
Hey everyone, good day wherever you are. I'm Tom Lowry, and as the earlier intro said, I'm with Microsoft and I focus on data and AI. I'm sitting here selecting myself to be distancing with others just outside of Monterey, California. I hope you're having a great day wherever you're social distancing yourself. So the focus today is addressing the iron triangle of healthcare with clinical AI. I'm very excited to be part of this program, and I want to thank Javion for the invitation. I've been asked to spend some time really setting the stage for some things around defining AI, how that compares and contrasts with a lot of the traditional things we've all done in healthcare when it comes to BI and AI. I'm going to talk some about other things like the rise of intelligent health, but a lot of this is really a background or context for Dr. Showalter to then come on and give us more specifics about the iron triangle and the value of artificial intelligence.
Hi, Tom. Thank you for a great setup to the discussion about addressing cost, quality, and access with clinical AI. Completely agree that it is important that we are on the same page as we have this discussion. But we're really looking at augmenting clinicians and not trying to automate or replace what they do. But when medical knowledge is changing that fast and doubling that fast, we need help keeping up. Javion has been working on this for the past 10 years, has been well recognized and received multiple awards for being innovative. But the big reason that we've been so successful is that we really have an approach that's based upon the needs of the industry, understanding that we've got to identify the individuals, we have to analyze the individual at the person level to understand what that person needs for us to intervene on, and that's got to start with data collection, data cleansing, moving the whole way through to the AI processing and getting it back into that clinical workflow so that the clinicians can be augmented. And one of the huge reasons for the need of this augmentation is the fact that demands are just getting worse. With the aging population and 3/4 of the elderly population has chronic diseases, that population is expected to triple. There's just going to be more and more burden on the healthcare system while there's increasing scarcity. The ratio of population to physicians is going down. There's actually an estimation that there's going to be over 100,000 shortage of physicians, 1 million vacancies for nursing. And if we can't get the clinical staff that we have more efficient, better, and more productive, we're going to have problems. This is not about replacing because we know we already don't have enough. Additionally, there's time scarcity for nurses. The average time they have to do a task is less than a minute. There's interrupted at least once to twice every hour. And only about 1/3 of the time is spent with the patient because the rest is doing additional tasks or paperwork or administrative work. And resources are getting more scarce. Recently we've even had PPE shortages. We've had drug shortages, manufacturing equipment shortages. So in healthcare right now, we have an awful lot of need to be efficient and to make our clinicians more powerful. And that need has created a tension between cost, access, and quality.
You've been listening to a brief excerpt from the Addressing the Iron Triangle of Healthcare with Clinical AI, Protecting Revenue While Improving Health Outcomes webinar presentation. This webinar was co-sponsored by Javion and recorded on August 6, 2020. The full webinar included an interactive speaker presentation with audience Q&A. You can watch the full webinar video by going to the link provided now on your screen.